Welcome to the AI+HI project. I'm Nicole Bradford, SHRM's executive in residence for AI+HI. Thanks for joining us. This week, we're diving into AI and the future of workplace mental health. Our guest is Marjorie Morrison, SHRM's new mental health executive in residence and the visionary behind Psych Hub and Psych Armor. Marjorie has spent over 30 years reshaping how we think about and deliver mental health support, from military families to global corporations. And today, we'll explore how AI can expand access, enhance support, and scale empathy without losing what makes mental health human. Marjorie, welcome to the AI+HI project.
Thank you, Nicole, so much for having me. It is an honor, especially since you are my role model of what an executive in residence at SHRM looks like. And I think I even got my title thanks to you. So I'm excited to spend this time with you.
Well, I'm thrilled to have you on this show. I am passionate about mental health and just following your background and looking at what you've done. You're, you really have done the good and noble work. So I appreciate you being here and also being at SHRM. But for our audience who might not know what a EIR for mental health does, can you tell us what is SHRM's executive in residence for mental health? What does that mean, and what are you going to be working on for your term?
Well, it's a great question. It's ever evolving. I think I have the best job on the planet. So I'm having like just the absolute best time. In part because SHRM is such a great, vast place to kind of plant yourself. I often say to people, 340,000 members in small, medium, and large companies in urban, suburban, and rural, and in 180 countries. There's just the tentacles into really the workplace are tremendous. So for someone like me that spent my whole adult life, my whole career in mental health, I really do think the workplace is where we're going to see like true mental health change, and for everybody, right? Like it was kind of the payers, and now the workforce, especially as they are all either self-insured or whatnot, they got to make sure their employees are focused and doing their jobs. So it's a great opportunity. My role is really I have a couple different parts to it, but it's really helping with SHRM's vision and strategy for mental health, really listening to our members, whether they are on the enterprise side, the companies, or on the HR, the professional side, but really listening to them and hearing what they need, hearing what they're dealing with, and making sure that SHRM is developing products and services and supporting our members to get them what they need. At these very critical times. I mean, you put AI and mental health together, like what could be more topical? And then I also get the privilege of sitting within the foundation. SHRM has a 501c3 foundation inside the SHRM Trade Association. And that is where a lot of mental health for employees, the sort of what they call untapped pools of talent. So you're thinking about people that are formerly incarcerated or military, sometimes people with disabilities, older adults, there's a lot of people that don't have degrees. So how do we help make sure that they are prepared for the workforce? And that includes that they are mentally healthy and supporting those with mental illness. So basically a lot of different things. I just get to help with mental health and SHRM.
Yeah, actually, that's why I came to SHRM too. The reach of this organization and around the issue of AI and how do we successfully not only get it into organizations, but also get it into society. Being able to have the vantage point of this membership, which is all sizes over so many different countries, it's really a great place to impact a good and healthy adoption of AI. So I want our audience to know more about your background because it's really stellar. So could you share your journey in mental health and what inspired you to focus on making mental health support accessible, and where along the way, because we are an AI show, has technology played a role?
Great question. Well, I like to say that I've been in mental health my whole life because my father was a psychiatrist. And so when I was growing up, we would have these like Sunday evening meetings. We were 4 kids in 6 years. So I had two older sisters, like lots of, sister drama conflict. And we had to have the meetings where we had to talk about our feelings and all of that. So I just joke that, you know, it was with me my whole life. And when I went to college and all my friends joined sororities, I joined the university crisis line, and that was like my friend group all of college. So I think it wasn't a surprise to anyone that I went to graduate school for to be a psychotherapist. I got licensed in California as a marriage family therapist. I also am licensed as a licensed professional counselor, and I'm a credentialed school psychologist. So I kind of have some different things. My very first job was in San Diego Children's Hospital outpatient psychiatry. And Nicole, it was working with some of the most challenging families that actually couldn't even get into the clinic. So I was doing at home, either at school or at home, counseling. And I think it's a great way to sort of cut your teeth on some of the most challenging issues because you really you see a lot. But then I had babies, and so I decided that was like really intense. So about every 5 years, I've had some kind of a new shift. But I went into private practice because it was a little bit more flexible for me in those earlier years. And I worked with the complete opposite. All, cash pay, high end, very, very, very different set of issues. So I kind of went from one extreme to the other. And then in 2008, right at the height of the Iraq and Afghanistan wars, I got the opportunity to go work at our Marine Corps base, a recruit depot, and work with the drill instructors. And at the time, drill instructors, in order to be one, you've had to have a few deployments. So I was working with people who were at risk and were coming in for help. And I got there. I don't know why I thought I could help fix them because I had no experience working with the military at all. But I had egotistical, I guess, didn't know what I didn't know. But when I got on base and no one was coming in, I quickly realized that we had an at-need population. And this is really ways AI can help so much. And like, how do we get them the right care? So I had great leadership there, and we developed a proactive mandatory counseling program, put all of the drill instructors through it, and then we scaled it over at Camp Pendleton with infantry. And now there's versions of it that are all Marine Corps wide, really the model of being proactive, I should say, instead of reactive throughout the DoD is prevalent in all of the different branches. I then started a nonprofit because SHRM, because I had some great philanthropists who wanted to make investments, and I felt like civilians like me that were only less than 1% of our country served. So we have 90% of us that don't understand the military. Like, how do we support them? And so I built Psych Armor as a place to create free online education for anybody, whether a veteran goes back to work, for employers, whether they are using commercial insurance and where they're providers, whether they're using the nonprofits and where they're volunteers. Like, how do we upskill the 90% of us that are not military connected? And then I ran that for about 5 years. And then a little over 5 years ago, I co-founded Psych Hub with Patrick Kennedy, former congressman. And the idea of Psych Hub, which is really my passion, and where to bring it back to AI, where we're going to make such a difference, is that most of us are trained as generalists. The vast majority of mental health were generalists, right? I was a generalist. And that means that if you think about it, every hour you're seeing something completely different. And we know you don't treat eating disorders like you would addiction or depression or neurodivergent. They're all of these things, complicated grief, have different evidence-based interventions, and they're called that because they're more effective at symptom reduction. And we don't know them. We're not trained in them. We're not incentivized to use them. We don't measure the outcomes of our clients. And so Psych Hub was, how do we upskill our provider base, get them focused on these evidence-based interventions, upskilling them? Also, how do we train consumers and help them understand what they should be looking for, of which AI is going to help super speed all of this? And then we built our marketplace to kind of help make it easier for people to find care. So once I built that up, Nicole, and was ready for our next gen CEO to take it to the next level, I was like, what's an area I haven't really been in yet? And to me, I felt like the workplace was the next frontier. And SHRM, as you know, has this very innovative CEO with Johnny C. Taylor Jr., and
Yeah.
he's a forward thinking, entrepreneurial, really, innovative, and I was like, "I wanna go work with him and see what we could do." So that was a really long answer, but
No, it's amazing. The and I love just the timeline of when you were, very early into using a platform and a marketplace to connect people in need with people who have skills, and then also sort of upskilling and educating everyone. Um, could you talk a little bit about workplace mental health and what the foundation is seeing? Like what is coming in from our members, and also research about, what is the issue, what's the scale of the issue, and then what is workplace mental health?
God, I'm so glad you asked that question because I say that all the time. Like my sort of mantra and all of this stuff, Nicole, is mental health is not one thing. So when we say workplace mental health, like what does that mean? I don't even know what that means, right? It's not one thing. You we would never do it in physical health, right? Like we wouldn't go to a cardiologist for a broken foot, right? But so I'm always trying to sort of break out this like what is workplace mental health? What does that mean? So that's a great question. I think what we're seeing in the foundation is really we're seeing a big shift. It Around COVID, even at the times when mental health, like you just heard, I've been in this space for a long time. I've seen stigma go from very, very real to the way other extreme, where now we have people wearing their diagnosis. They're proud of them, especially younger people. It's very different. So it used to be we were teaching mental health competency to workplaces. We were teaching them understand the difference between bipolar and borderline and all of these different things and what to do and how to support. That model is shifting. The pressure that HR and people managers have to manage people's mental health is very, very, very taxing. And I think the shift that we're seeing now is use empathy, show that you care. It's okay to create psychologically safe environments where people feel like they can come in and they can talk about what's going on, but then immediately know when you're going too far and get them over to the benefits, to get them the resources or accommodation teams, to get them the right accommodations. Because when you feel, and HR, we hear this all the time from our members, if you feel responsible for solving someone's problems, that is such a heavy burden to have all day long. And like as a therapist, we're trained, right? But HR doesn't always get trained on how to manage that. And it's not their job, right? And so ultimately, they got to have employees that can get the job done. So I think that's really the shift that we're seeing is the training needs are different. The expectations of how involved HR managers should be and shouldn't be has changed.
So what I'm hearing is that it's also really equipping HR leaders, and for HR leaders to know that, well, let me step back a bit. So one of the things that has happened is that people are much more informed about what's going on with them, so they're better able to ask. I also saw that, in my work, I've been interested in human potential and technology for the last decade, and I've been working really actively in it. And so back in 2014, when I first started this work, I was showing up in spaces and saying, it isn't necessarily that technology is bad, it's that it's not good enough. We are not pointing technology towards the things that really will help us heal, grow, and thrive. And to that end, we should take some time and discover how we might use technology for mental, emotional, and social health. I call it mesh. How do we strengthen the
I
human
love
mesh?
it.
Yeah, and back in 2014, it was really interesting because, I had just come off the back of operating World of Warcraft China and all of the video games, head of operations for all the video games for Blizzard Entertainment and Activision Blizzard. I'd worked on the Activision Blizzard merger, and, through a variety of sequences, I became really focused and committed to, helping us, all of us, heal, grow, and thrive. And because I had a background in technology, it seemed obvious to me that you would use technology in these spaces. So this was 2014, and this was, you know, um, Calm hadn't been founded yet. Headspace was still a meetup in London, and they had like you could get the audio files. So it was like really way back in the day. And when I started talking about this, people would say, like, on the tech side, they were like, "What? You're not building a champagne delivery app?" Like, let's solve the big problems. How can I get champagne in 5 minutes or whatever? I'm being a little funny there, but, I felt like people were really expecting me to do surface level things because technology was very much in that space then. And then on the other side, sometimes when I would speak to people who were involved in healing, growing, and thriving in 2014, they were not comfortable having technology in those spaces. And, I grew up in Houston, Texas. My dad was a plumber. He worked with his hands. Have a very or my orientation is that I really want people to have access to the things that can help them heal, grow, and thrive. And I believe that technology makes things available, accessible, and affordable. And so we should use it, but figure out how to use it. And so that's just the context for this. What I've seen is post pandemic, like, because I like pre pandemic and post pandemic, the to your point about the reduction of stigma, before the pandemic, when I would talk about mental health and technology, people would there was a lot of questions, or it was an over there problem. But with the pandemic, the whole world, everyone, either themselves or they knew someone or loved someone who was struggling, and it just completely changed. So what I heard from your answer before is that, people are rolling into work with a completely different set of expectations around mental health, and our HR leaders are on the other side of that, and they're no longer in the place where it's like, "Oh, what is this versus that, and where do I send them?" And it's like they're really, asking and wondering, "What is my role? Where does it start? Where does it end? How do I support the person?" And then also ensure that they're, doing the work that we ask them to do.
Right, right.
So from your perspective, what does meaningful integration look like with AI and mental health, and how should we do it empathetically?
Well, I mean, they're great questions. I think first we have to just sort of acknowledge that, to your point, you were in on this early. There's like excitement and there's fear, right? About how to integrate it. And it's understandable. I mean, we're talking about using AI for one of the most sensitive human-centered parts of life. So I think the fear comes from a real place. I think people worry about, as putting my clinician hat on, right? People worry about privacy or misdiagnosis or replacing the human connection. So, like, I understand that. But to your point, I mean, the real opportunity, it's not to replace human care, it's to enhance it. And I believe, and I'm so like you, I'm so excited to see how AI can like help us get to the right care to the right person faster, right? Like it can help identify patterns we might miss, like early warning signs, like just for providers, like you already can see so much of the admin load that's being lightened by even just office management kind of AI. And it can guide people to like very personalized support. So I think that, to your point, we have often an access issue. Not always. I don't believe the access issue is as bad as people think, but wait lists are long, providers are burnt out. And like these AI tools can really help triage and scale access and do all kinds of all kinds of things. So I think we just have to really think about like how we're doing it, and think about like I think about the complexity of the challenges in AI in like two ways. Like the first, it requires a nuance in data, right? So if we're only tracking absenteeism or productivity at work, we're missing the full picture. So we need AI that can integrate like multiple data points, behavioral, contextual, even environmental, to make those meaningful insights. And then I think the second piece is we have the opportunity with AI to really create personalized pathways, not just like generic nudges, but like how do we help someone who's managing social anxiety? And how does AI help with that different from someone who might have compassion fatigue or guilt? So I just think when we think about how to integrate it, we just have to think about how do we use these tools and make sure they're being built from a diverse lived experience, because that's the other thing we're learning, that, they're only good as sort of how they were trained. So if we can get that right and we can actually decode some of that complexity, I mean, I think we could completely change the way mental health care is delivered.
One of the things that you said that's really resonant is that one, there's not one mental health. Two, there's not one type of AI for mental health. I think a lot of times when people hear it, they think, oh, they're replacing therapists or that sort of thing. But, in the entire, you know, uh, client experience to mimic the employee experience, there's pieces where, a different AI tool can make a big difference. Like many people don't know, as you mentioned, about the matching problem. So what that is for our audience is that if you go to a therapist, let's say you get in and like 6 months later you get in to see someone. If you don't have chemistry with them, if you don't feel like if they reminded you of the person that you have a problem with or that brought you there in the first place, and you become a rejecter, it is highly unlikely that you will ever go back. And so, the ability to use AI for the matching problem, the ability to use AI to get people to the right solution, whether it's checking to find out what, if they do need drugs, molecules, checking to find out which molecules are the right ones for them. And so, just like we're starting to get very granular in how AI can support the employee experience in general, the same thing is happening for the steps in mental health. And I just think it's really exciting. So Marjorie, for our audience, where do we draw the line between what AI can do to support mental health and what do we think should always remain human?
I mean, it's another great question, and I think it goes back to the, mental health is not one thing. And so I think the key with AI is knowing the difference between what can be automated and what absolutely has to remain human. So I think about it like AI can assist with the what. And the what is pretty much what you said: screening, triaging, reminding, nudging, even helping people, like, identify concerns they might have. It even can help with training. It can surface patterns, right? It can help us with access because we can do more specialty stuff, but AI can't do the how. It can't hold the space for someone's grief. It can't read between the lines in a hard conversation. It can't, like, provide that warmth of human connection, right? So there's this relational support, empathy, the clinical judgment. It always has to be human from my perspective. So really, like an AI tool, it might be able, like, thinking about a workforce, like it might be able to help an employee check in on their stress levels. Maybe it can help suggest a mindfulness exercise. But when someone's really struggling and there's real trauma or burnout or some crisis, that's when a trained human needs to step in. So I once heard someone say, like, AI can flag the red light, but it shouldn't be the one driving the rescue vehicle. So I like that. I just think we have to be really intentional about using AI to support, not replace the human relationships. Like we're at the heart of mental health, but I think done right, oh, we can do scalable, equitable care. And to comment on what you were just talking about, Nicole, as far as like the different ways we're already seeing AI training too. I've been over the past 10 years in training. Like now they have AI technology that can listen to a therapist while they're in session and then able to provide that feedback to them to help them get better and craft their skills. So if you think about specialty care, like I mentioned, like you can get better and better in that. And also, we talk a lot about measurement based care, which is really important. And we don't do it in mental health very well, which is how are we actually evaluating the care to see how it's working, both from the client and from the provider. All of that AI can really assist with as well.
One of the things that I feel like I'm hearing in what you're saying is that sort of the same evaluation or the same way we're sort of walking through what in HR should or should not be delivered by technology feels very similar to any other place, including mental health, where there's a big human role, because organizations are really just people doing things together, and so the people part's very important. So I feel like there's something to learn both ways. Okay, so to finish up, two questions. One, what can our HR leaders look for from SHRM to help them navigate this line? And then after that, if you could tell us and tell our audience, okay, they've heard this podcast, they've heard our conversation. What do they do on Monday? If they want to deliver better mental health and workplace mental health, what do they do on Monday? So, question one, what can they look for from us? And then question two, just practically, what can they do on Monday?
I think on question 1, I would say right now, Nicole, I'm going on what I'm calling a listening tour. And instead of thinking that I know what's best for our members, and when I say that, I mean small, medium, large members, like we talked about, I'm really listening to them in what they need. And I hope that I get the opportunity, if I'm successful in this role, is that we can help develop the products and services that they need instead of, like I keep saying, we got to flip the script. We got to stop developing things and then saying, here you go, and instead listening. And I am learning a lot. And SHRM has a knowledge center, and people are calling in and asking for me, and I'm learning from them about what their needs are. So I'm not there yet of exactly what we need. And I think it's going to continue to change. But at least I'm making, a commitment to really emphasizing what their needs are. We're here for our members. And so the only way we're going to constantly be innovative and delivering the right stuff for them is really getting in and listening to their problems. So I'd say that's the first thing. I think the second question, which is a really good question, I have a perspective on this because I've seen this over the years change. I think that mental health, HR professionals, benefits people, they work so hard to determine what mental health benefits there are. There are so many point solutions coming at them. Everybody has the end all be all, and really nothing's getting any better, right? Increase is going higher, engagement is going higher. So I guess that's better. People are using it, but it's not helping. We're still in the midst of a mental health crisis. And so sometimes more isn't the answer, right? So the question about what is on Monday, I would challenge people to actually look at what they have. So I'm just going to go on a tangent here for a second, but you'll see why. In COVID, what happened was private equity and venture capitalists came in and invested a whole bunch of money in mental health. And where that benefited us is that we saw a whole bunch of roll-ups, right? So it used to be that all mental health was what we call single shingles. Like I was one, we're all separate, not part of something. Now you're seeing these massive roll-ups where these organizations are doing the back office stuff enabled by AI, but things like scheduling, things like, the platforms for video, telehealth, and note-taking and all of that. Well, most of those larger aggregators or roll-ups, whatever you want to call them, they take insurance now. So now for the first time, you're really seeing a lot more excessive availability for care out of your typical, Aetna, Cigna, Anthem, Elevance, United Healthcare, Optum, whatever insurance. And we're seeing more and more specialty care of these roll-ups showing up. So we have Equip that does eating disorders and NoCD that does OCD. All of these are covered by your insurance plans. So I think that the issue, in my opinion, is screening and navigating. We need to get employees knowing what they need, knowing what they look for, and helping them get there. It's not having to get more resources. This is my opinion. I don't think they need more. I don't think we need to spend any more money. It's knowing what they have and knowing how to create that navigation process.
Okay, so step one when you go back is just look at and audit what you have and see how it's working. So I like that. That's really tangible. So, okay. Thank you, Marjorie. A big thank you to you for sharing your insights and transforming mental health with technology and keeping people at the center. While we wrap up, everyone in our audience, I really encourage you to follow the AI+HI project wherever you enjoy your podcast. And if today's conversation sparked ideas or gave you a perspective, please take a moment to leave a review and help us spread the word. And you can find all of our episodes at shrm.org/AIHI. Thanks for joining the conversation, and we'll catch you next time.
SHRM.